Hello and welcome to Health News. I'm Yomi Otaigbe. One of the very effective ways to disease prevention is the time-tested vaccination. From one part of the world to another, immunization has helped in keeping infections at bay or limit their deadly impact on the human body. But despite the potency of vaccines that have been trusted to prevent millions of childhood deaths, a lot more millions of children the world over, especially in developing countries such as Nigeria, are said to be missing on the full immunization chart. Our focus on the program this week is on the need for parents and caregivers to make their children or ward available for the complete routine immunization, thereby equipping them with one of the world's most powerful tools for health. The World Health Organization says immunization averts an estimated 2 to 3 million deaths every year, providing protection from diphtheria, measles, pertussis, which is whooping cough, pneumonia, polio, rotavirus diarrhea, rubella and tetanus. Yet an estimated 22 million infants are not fully immunized with routine vaccines. Here's a report on what vaccines are and the health benefits of vaccination.
A vaccine is a biological preparation that improves immunity to a particular disease. A vaccine typically contains an agent that resembles a disease-causing microorganism and is often made from weakened or killed forms of the microbe, its toxins, or one of its surface proteins. The agent stimulates the body's immune system to recognize the agent as foreign, destroy it, and remember it, so that the immune system can more easily recognize and destroy any of these microorganisms that it later encounters. There are several types of vaccines in use. Some vaccines contain killed but previously virulent microorganisms that have been destroyed with chemicals, heat, radioactivity, or antibiotics. Examples are the influenza vaccine, cholera vaccine, hepatitis A vaccine, rabies vaccine, and polio vaccine. Also, some vaccines contain live attenuated microorganisms. Many of these are live viruses that have been cultivated under conditions that disable their virulent properties. Examples include vaccines against yellow fever, measles, rubella, and mumps, and the bacterial disease, typhoid. Others are conjugate and toxoid vaccines. Although it's been said that not all vaccines guarantee complete protection from disease, vaccines have come a long way. One of its major contributions is the eradication of smallpox, one of the most contagious and deadly diseases known to man. Also, other diseases such as rubella, polio, measles, mumps, chickenpox, and typhoid are nowhere near as common as they were 100 years ago. As long as the vast majority of people are vaccinated, it is much more difficult for an outbreak of disease to occur, let alone spread. Immunologists say the impact of vaccination on the health of the people is hard to exaggerate, adding that with the exception of safe water, no other modality, not even antibiotics, has had such a major effect on mortality reduction and population growth around the world.
To tell us more about the importance of immunization, dispel some myths surrounding vaccines, and address your fears on immunization issues, here's my guest, who is a Deputy Director in the Lagos State Ministry of Health, Dr. Folashade Oludara.
Immunization is a preventive measure to prevent children from getting childhood killer diseases, and is either given by injection, some are given orally, and it starts at birth, immediately after a child is born. That's when immunization starts. And you know, in this part of the world, third world countries where we're still developing, there is there are lots of, we have challenges with environmental sanitation and all that. And most of these diseases are actually transmitted from the finger, dirty habits, into the mouth. And just to protect these children, they need to get immunized.
Is immunization all about the children?
No, not just for children alone. We have pregnant women. We have immunization for women of childbearing age. We also have for adults, depending on any outbreak. If there is a period of outbreak somewhere, for instance, like meningitis, you have immunization for cerebrospinal meningitis. And then we have routine immunization for regular travelers, like yellow fever, that we can give to adults as well. Okay. So it depends on the age group. But the immunization, the real immunization actually is to protect our eligible children from catching deadly diseases, childhood killer diseases, and there are quite a number of them. And once they get a complete immunization, by the time a child is about 9 months, the child is assumed that is supposed to have completed one full course of immunization.
So tell us about the different types of immunization that a child gets before he or she comes of that age.
Okay, at birth, the child is exposed to BCG, that's immunization against tuberculosis, OPV, that's oral polio vaccine, which is against poliomyelitis, and then HBV0, that is immunization against hepatitis B, that can eventually, if not taken, the child can eventually be exposed to hepatitis, and then complications such as hepatocellular carcinoma later in future. And then that's at birth. The child is expected to come back again at 6 weeks to take OPV1. At birth, he must have taken the OPV0. Then at 6 weeks, OPV1 and pentavalent. The pentavalent used to be DPT, and that has about 3 vaccines inside, embedded in it. But the pentavalent has 5 vaccines incorporated now. And in pentavalent, we have the 5 vaccines are the against diphtheria pertussis, tetanus, hepatitis B, and Haemophilus influenza B. So those are the 5 that are embedded in the pentavalent that we started last year.
Some side effects, that parents would normally complain about after their child or what gets vaccinated. It's a fever. Some even say it's after this vaccination that my child got this paralysis. Sometimes it makes parents or caregivers not to want to go back to getting the child immunized. Tell us about what parents should expect when they go to immunize their children.
Immunization does not give paralysis. Rather, the refusal of immunization can lead to paralysis. And there's really no serious side effects about immunization, apart from maybe little. It's not even for all children. For the injectables, there might be little pyrexial, and it's not long lasting. It's a very short lasting thing, and usually medical workers, our health workers at the primary care centers and all our health facilities have been trained to inform the parents that, okay, don't worry, your child may develop a little temperature, but you can give just 1 or 2 doses of paracetamol to take care of that. And just as I was saying, at 10 weeks, the child is expected to come back again for another set of pentavalent and OPV2. And then at 14 weeks, the same thing happens. And then the child now comes back. By the time the child is 6 months, the child is supposed to be introduced to vitamin A, though that is not immunization, is a supplement to prevent blindness. And then at 9 months, that is the final age for the childhood immunization. The child is going to be exposed to measles vaccine and yellow fever vaccine as well. Okay. So that completes full course of immunization for any child.
They recently introduced the pentavalent vaccine, which is like a 5-in-1.
Yes.
Some parents have said, this is too heavy at once for a child to take, and they have concerns about it.
We've not had any record of that, apart from the normal expected febrile reaction that does not last more than 1 or 2 hours. And usually paracetamol takes care of it.
Okay, now Let's look at immunization coverage in Nigeria. How would you rate the level?
Well, right now, I think we are making headway. At least I don't know about Nigeria, but I know, I can talk a little bit about Lagos State. We are making a headway because, the perception of people is changing gradually. And initially, the reception was not so good because people were not well educated. They were not well sensitized about the importance of immunization. But with the increasing level of education and awareness, people are already accepting it. And our immunization status, the coverage is getting better year in, year out. Generally, we have three categories. There are some that are well knowledgeable, they complete the immunization. They complete it, they know the importance of it, and they bring their children immediately they are born. They are aware that this child needs to be covered, needs to be covered from childhood killer diseases. But there are some, probably from fatigue and from what we can call ignorance, they drop out. Those are the ones we call dropouts. They take like 1 or 2 doses, probably by the time the child is 14 weeks old, or they forget to come back at 9 months to get the measles vaccine and yellow fever, which is very, very important. And there are some that don't even come at all because of maybe socio-cultural beliefs and all that. We're still working in Lagos, frantically about that, because we still have quite a number of, dropouts, and we have some pockets of those that do not even come at all. So that's what we're working on. And my message to every parent or caregiver is that they should, as much as possible, ensure that that child completes immunization. That is when you can know or categorically say that this child has enough immunity or prevention against these childhood killer diseases. Because starting from tuberculosis, we all know what tuberculosis can cause, even in an adult. Talk less of a child that's immunity is so low. So for such a child that was just born, and for the child not to be covered with BCG, you can imagine what will happen with such a child if the child gets in contact with a patient with an active tuberculosis infection. And the same thing goes with the polio too. There is a lot of sanitation challenges we have in our environment, and even our personal hygiene. The personal hygiene of most people is questionable. So with that, a child is exposed to getting poliomyelitis, which can result into paralysis. And wouldn't want, no parent will want such a child to, to bring a child to the world and then without any deformity, and the child later develops a deformity. So what I will say is that for every caregiver, once there's an opportunity to give immunization has no side effects to the body. It's very, very safe. It's been proven. It's gone through a series of laboratory tests, and it is safe for human. It is safe for the children that are receiving it. It's been tested over years, and those are things the developed countries are using to reduce their child mortality rate. And I see no reason why we cannot do the same, because a lot of our children are dying every day, and mainly because of ignorance, which we can prevent.
So what do you have to say to people who have concerns over what they call the overdose, especially over the oral polio vaccine?
Well, there's really no overdose when it comes to the campaigns. I know that's where your agitation is. Like we had one campaign in December against poliomyelitis. We have another one in February, and then we have the last one in March. There is no the amount of time, the time interval that is necessary to put in between this immunization had been worked out, even at the national level, even internationally. Because when we talk about campaigns, it is not only Nigeria that is involved, it is the whole world.
You've said we are not yet where we should be concerning immunization, and what are the challenges?
Well, there are challenges that there are 2 types of immunization now. We have our routine immunization, which we actually encourage people to take part in. if our routine immunization is strengthened, we might not really need all these campaigns. Because if every mother or caregiver takes the child to get the complete immunization, then what we are talking about, the herd immunity will be raised, and then these children will not be coming down with childhood killer diseases. Eventually, all these killer diseases will phase out. But right now, we still have some percentage. The acceptance is still not too high. It's not too high, and when it comes to routine immunization. So that's why occasionally the government with the international partners have to come together and decide to do intervention programs, just like the campaigns. Because if there is because of the non-acceptance and the non-attendance at clinics, by caregivers. Most people, when they deliver, they probably take the first dose, the first immunization doses, and probably when they are coming for post-natal clinic, they bring the child, of course. You seize the opportunity to immunize the child again. But by the time the child is 14 weeks, everybody relaxes, they forget the measles. Measles is about the most battered or most rejected, or what should I say, most dropout vaccine antigen that we have right now. Because by the time a child is 9 months, it's like the parents or the caregiver already forgot that, this child is also due. There's an immunization trend we're following. So what we are trying to do is to do a lot of advocacy to be able to correct that and let people, be aware that this child, you can say congratulations to bringing a child to the world after the completion of immunization at 9 months, after measles and yellow fever.
One of the very important aspects of immunization is the cold chain, because vaccines are supposed to be stored at certain temperatures, and if not stored, they could lose their potency. You find that some private hospitals also are involved in this routine immunization. How effective would you say their cold chain is, and even on the side of the government?
Of course, I could see that as a big challenge, but as long as the caregiver or the parents take the child to a government facility or a government-approved private hospital, there's really no cause for alarm. Because why I said private hospital is that we are also involved in the immunization services. We give them the vaccine free of charge, and then we assist them to package the vaccine in such a way that even if they need it for the whole day in their clinic, the vaccine will still maintain potency, because we pack it, we have ice packs. There's a technical way we pack it from the cold store where they're taking it from.
Did you say free of charge? Because sometimes you go to these private hospitals and you still pay some fees and all of that to get your child vaccinated.
Well, I know for government, I can only speak about government hospitals now. Of course, anybody that comes for vaccination in government hospital, we get it free. But for private, they are free to say they want to charge for their cards. For instance, charge for their registration, their logistics, which we don't have any power over. That's why we have all these services at the primary care centers. And we always encourage our citizens to go to the primary care centers nearest to them to get the facilities, the services free of charge.
If you have other questions for Dr. Folashade Oludara, you can get in touch with us on healthnews@channelstv.com or on Twitter at yomi_otaigbe, and you can also send us a text on 081-864-38129. Okay, we still have some time to bring you up to speed with other happenings on the health scene.
We start off the news segment with a not-so-cheering report that scientists from the University of Oxford and Mahidol University in Thailand have identified a new drug-resistant strains of the parasite that causes malaria. Researchers found parasites in Western Cambodia that are genetically different from other strains around the world. These organisms are able to withstand treatment by artemisinin, a frontline drug in the fight against malaria. Reports of drug resistance in the area first emerged in 2008. The problem has since spread to other parts of Southeast Asia. In the meantime, health authorities in Nigeria have been advised to put in motion a more aggressive pharmacovigilance network that would help detect any emerging resistance to the current artemisinin-based malaria treatment drug in Nigeria. The coordinator of Malaria Research Program at the Nigeria Institute for Medical Research, Yaba, Lagos, Dr. Sam Awolola, said a lot of factors could be responsible for the drug resistance.
In most of these situations, like we have for chloroquine, we abuse the drug. Many a time we use substandard dose of the drug. Many a time we use fake drug. We have fake, even in Nigeria, there's a number of fake ACT in circulation. So when the drugs are not properly used, when people don't follow the drug regime, when people don't use the correct dosage and so forth, it can lead to the drug resistance. So there are various factors that could be responsible for the drug resistance, but I think we should go zero in that what can Nigeria do to prevent this. So I think the first thing we have to do is that pharmacovigilance has to be strengthened. We have to strengthen our pharmacovigilance, ensure that we monitor this drug, the efficacy of this drug periodically. It's not something you monitor in 1 year and you forget it.
Moving on now, the Nigerian Association for Cleft Lip and Palate is looking into how the risk for lip and palate deformities in children can be reduced in Nigeria. The third biennial conference of the association in Lagos highlights issues around the condition while also looking at the sustainability of cleft care in the country.
Cleft is a congenital. What I mean by congenital is that it's a condition that a child is born with. It's not like an accident or anything or infection. A baby is born with this defect that the lip is not completely formed, that the lip is not joined together, there's a gap between the lip. And this can extend also to affect the roof of the mouth, which we call the palate. So we can have cleft of the lip alone or cleft of the lip and palate. Unfortunately, there is nothing that can be implicated as a primary cause of cleft and palate. But what we have done is that there are some associated conditions that have been related to this. And these associated conditions can either be from how you are born, which is genetic. It can also be environmental, which means circumstances in your birth, whether the type of food you eat or circumstances that affect your pregnancy.
The most fortunate thing about this deformity is that it is totally curable. Surgically, it can be surgically corrected.
The cleft lip and palate patients that we treat in Lagos University Teaching Hospital, Diaraba, are expected to come to the clinic anytime they are delivered or they are given birth to by their parents. Although we run a clinic at 1 p.m. on Tuesdays between the hours of 1 to 5 every Tuesdays, and the surgeries usually take place on Thursdays every week.
It was indeed a great day at the Lagos University Teaching Hospital, Idiaraba, Lagos, where parents, friends, graduating students, lecturers, and well-wishers all gathered at the new Great Hall at the university for the joint graduation ceremony for the award of diplomas, certificates, and prizes to over 100 students graduating from various medical fields, which include Community Health Officers Training Program, School of Health Information Management, Medical Laboratory Science, Medical and Psychiatric Social Work, Nursing, Midwifery, Basic Dental Nursing, and Post-Basic Nursing. The Chief Medical Director of LUTH, Professor Akin Oshibogun, said these new professionals would add value to various health services in the country.
Many people assume that the teaching hospital only provides service. Many people don't recognize that we are also involved in developing human capital. So these people that we have trained are going to work in different parts of the country. Some have come for post-basic nursing training, which is a postgraduate training program in different areas or subspecialties of nursing. And they are not all going to work for us at the Lagos University Teaching Hospital. Some will go to state governments, other state governments all over the country.
And And we head to Ogun State, southwest Nigeria, where efforts towards reducing the HIV/AIDS transmission in the country got a boost as members of the National Youth Service Corps, NYSC, in Odo-Ogbolu local government took the awareness campaign to the grassroots. Championed by a corps member, Ayodele Samson, the awareness campaign train went through the market square and major streets in Ilisha Remo, where the locals were enlightened on how to protect themselves against HIV/AIDS, while asking the youth to maintain a healthy lifestyle and ensure self-discipline. The corps members preached against stigmatization and discrimination of people living with the virus.
Everyone has to take responsibility about what happens to him. And as we can see, HIV, as you said, is a pandemic disease which is everywhere, and till now it has no cure. If you cannot abstain, if you cannot hold your body, if you cannot do away with sex, then we are asked to use condom.
That's our package for this week. Thank you for being a part of it. Don't forget you can reach us on any of our feedback platforms. I am Yomi Otaigbe.